to the other side of this conversation because knowing what to look for in a great partner is only half the equation. The other half is what we bring to the table as referring optometrists. From the ophthalmologist perspective, what does a great optometrist referral look like? And what can an OD do to make the process seamless for both their patient and your practice?
Obviously, communicate the reason for the referral. Um, a fax that just says blurred vision is not that helpful.
Right.
Obviously, we can talk to the patient and try to figure things out, but we don't want to have to reinvent the wheel. If the reason is cataracts, then we need to know are we at the point that the patient's frustrated and cannot be optically corrected and has visual symptoms consistent with cataract? Are they ready for surgery, or is this just an introduction that maybe they will need surgery in somewhere down the road, and we're just trying to get the patient comfortable with the fact that the cataracts are the reason for their blurred vision, and that's the reason why their vision isn't the greatest with their last pair of glasses. If it's a young person that we suspect keratoconus, to use as another example, we need to know why the optometrist is suspecting keratoconus. Is it just that their astigmatism jumped over the last year or two significantly? Is it actual topography changes that if an optometrist has a topographer that they're seeing? Is it automatic keratometry reading changes that they're seeing? We need the details. The more details we have, the more information sent over with the referral, the better the encounter will be with the patient when we see them for consultation, and it will lead to a better experience for the patient. And the more information that the optometrist gives the patient at the time of the referral, and the education that the optometrist gives to the patient for the referral is important, so that we can have an intelligent discussion with the patient regarding the risk, benefits, and alternatives for treatment that they're being referred in for.
Right.
Empower the patient with knowledge,
Yes.
educate him as much as he can. Um, I hate to use the term, just Google it, but we have some excellent AI tools, Open AI, Gemini. There's a lot of useful information. Yes, there's some misinformation that the patients will see, but I find that a better educated patient will make better decisions
Right.
once they get to our office, and we don't have to uh, reinvent the wheel as far
Right.
as getting their mindset as to why they're being seen. And it's not as scary of an experience. uh, so details, educate the patient, communicate as much with the initial referral. All that information will be helpful with the insurance approvals for whatever care that they might need. Um, Going back to my keratoconus example, most commercial carriers require proof of the change of topography changes. They're the characteristic of keratoconus. So whatever information the optometrist has ideally should be sent over in
Right.
our portal or with whatever communication that the optometrist uses with their ophthalmologist to communicate such.
Yes, the data is important, right? That instead of
Of course.
you having the patient in front of you and saying, what can I do for you today? And they're like, I don't know. My other doctor told me to come here.
Right. Right.
So let's say and this is one of the things that I think you really excel in, which is the follow up, right? So let's say I refer to my patient. What does a timely, meaningful communication look like from your practice? And what advice would you give an OD who maybe isn't getting the communication that they need to follow up with their patient?
Our practice has a system through online portal system that's secure, that our IT department has developed to immediately communicate when a procedure is done, or what the advice of the consultation was on initial encounter. Um, and that information is communicated usually within 24 hours back to the optometrist's office. Um, in a co-management situation, especially if the optometrist is seeing the patient day one, they need to know exactly what procedure was done, obviously,
Right.
and what technology was used, basic stuff. But the optometrist does not want to be in the dark when the patient shows up in their office the next day and
Right.
the optometrist doesn't understand why they're there. So obviously, the ophthalmologist needs to communicate what was done, when it was done, and what is needed out of the optometrist for the proper care of the patient postoperatively. As far as in-office communication, as soon as the patient's seen and our doctors have signed off on our assessment and plans. That assessment plan is communicated back uh, again through our portal system, or if the optometrist doesn't use a portal, through secure HIPAA compliant faxes and email communications.
So if there's one habit or system change that optometrists could implement tomorrow to immediately improve the quality of their referrals, what would you suggest that be?
Get used to sending details. Ideally, utilize the technology that we have on hand so that we're not wasting a lot of time. The whole point of the portal system is to make the communication seamless and effortless, so that you're spending more time with your patient in the lane and not just wasting time, trying to get a fax machine to work. Implement technology to your advantage to facilitate that communication so that you can spend more time in the lane, actually administering care and advising your patients as to their care.
So the system that you use, is that a system that is general that any ODMD can use, or was this a system that you developed? And is it, I would assume, an app or a portal, I guess, a browser?
Yeah, so our electronic health system, CompuLink, has this built-in portal system that any registered provider can link up with, and like I say, is secure. And most of our optometrists have found to be very, very helpful as far as the ease of the transfer of care and how to utilize the information from their electronic health systems. Or if they don't use EHR, even a paper note can be scanned and sent through the portal. There's a lot of ways that make it easy for the optometrist to communicate their information and reason for referral to the ophthalmologist.
I believe the most important thing here really is the communication between you, your staff, and the OD referring and their staff. That's like the key point of being able to provide our patients with the best care.
I'm sure I surround myself with very talented people that make me a better person, and they make it work for all of us.
Absolutely. I think that alone is a whole article on how to onboard excellent staff, right, that are very aligned with what we're doing. So before we wrap up, I want to ask you, and this is for every OD watching, whether you're still searching for the right ophthalmology partner or you're ready to show up as a better referring doctor, what is one thing that you want ODs to walk away from this conversation knowing?
Know that you can trust your ophthalmologist, and the ophthalmologist will help make uh, your practice a better practice. We're here to help grow an optometrist practice. All win only if we all win together.
Absolutely.
Uh, patients and optometrists and ophthalmologists. And it's all about the best patient care, of course, and that's what we're all trying to strive to accomplish, is to deliver the highest level of care to all of our patients. So know that you can trust your ophthalmologist, and you have the tools to be able to facilitate the transfer of care back and forth.
Dr. Kovach, this has been such a valuable, insightful conversation. Thank you so much for being so open and so practical with our audience. For our ODs watching, I want you to leave today with one intention. Identify one thing you heard in this interview and put it into practice this week, whether that's picking up the phone or emailing to connect with your referral partner, or rethinking how you prepare your patients before they walk into an ophthalmology office. Small shifts make a big difference. I'm Dr. Diana Canto Sims. You can find more conversations like this one through Optometry Times. Thank you so much, Dr. Kovach, for joining us. We will see you in the next one. Bye.
You're welcome.